Always begin by either washing or sanitizing your hands. Remember, this is critical in preventing the spread of germs. The second step is to put on the appropriate personal protective equipment. We recommend wearing gloves, but check with your supervisor for the specific requirements. And remember, it's important to treat all blood and body fluids as potentially infectious. So be sure to follow the blood-borne pathogen cleaning guidelines throughout this procedure. Next, empty the trash by pulling straight up on the liner. Never push the trash down with your hands. There could be sharp objects inside. As you lift the bag out, hold it away from you. Then just tie it off and place it in an approved disposal container or, when necessary, a red biohazard bag. Now clean both the inside and outside of the trash container with a disinfectant cleaner and a new cloth. Make sure you do not use this cloth on anything else. Then to finish, just insert a new liner into the trash can. Just like in detail cleaning, dust areas that are not cleaned on a daily basis. This includes ceiling vents and corners, curtain tops and blinds, TV cabinets, fixtures, doors, closets, cubicle curtains, and along baseboards. It's always best to dust from high to low. This will prevent dust from contaminating an area that's already been cleaned. The next two steps are new. First, look around the room for any items that the patient may have left behind. Return anything found to your supervisor. Then disinfect the inside of all drawers and closets. Allow the drawers to air dry by leaving them open. Using a new cloth, disinfect all surfaces that people normally touch, such as the bedside table, telephone, bed frame, windowsills, and any other furniture in the room. If you are using a spray bottle, it's important to spray disinfectant cleaner onto your cloth rather than directly onto the surfaces. This will prevent overspray. If you are using a bucket, make sure the surfaces get thoroughly wet and change the solution every third room or when visibly soiled. Next, strip the bed and place the linens in the designated containers. And disinfect not only the entire bed frame, but also the mattress. The mattress should be checked for any rips and cracks. Any damage should be reported to your supervisor. Be sure to clean corners and baseboard surfaces with disinfectant cleaner using a mop or appropriate tool. Spot clean the walls with a disinfectant cleaner. Be sure to remove any marks or smudges. Then follow the restroom cleaning procedure using the appropriate checklist. Now you are ready to dust mop. Using an S pattern, start in the farthest corner and work your way towards the door. If anything is stuck to the floor, use a putty knife to carefully remove it. The next step is to post the wet floor sign prior to cleaning. To clean the floor, dip your mop into the disinfectant cleaner and mop the entire area. Allow the disinfectant cleaner to remain on the floor according to your manufacturer's label. In order for the disinfectant cleaner to be effective, it's important to change your mop head and cleaning solution every third room or when visibly soiled. Next, remove the wet floor sign once the floor is dry. If your room has carpet, you should check for spots. If you discover any spots, use the appropriate spotter and follow the instructions. Then, vacuum the floor, making sure to overlap each area to avoid any missed spots. Be careful to keep the cord out of traffic areas, and check the vacuum cleaner bag frequently. After cleaning the patient room, it's necessary to conduct a final inspection to make sure all surfaces have been properly cleaned. Make note of any problem issues for your report to the supervisor. Then, remove all personal protective equipment and dispose of appropriately. For example, this may mean throwing anything disposable into the trash, or anything non-disposable into an appropriate bin. And finally, the last step is to wash or sanitize your hands. This will help to protect against the spread of any harmful germs.